High-level soccer has a ton of lower extremity injuries. Obviously, you would suspect that given the sport, but we see a lot of ankle-related injuries, foot-related injuries, but there's a high degree of ACL-related injuries, especially, unfortunately, in female athletes. Female athletes in general are at a significantly higher rate of chance of injury in their ACL than male athletes. The sport itself requires quick, sudden movements, and everyone nowadays is bigger, stronger, faster maybe than they used to be, while those forces may be increased across the knee ligaments are still historically the same size. And then you also think about how much we're doing. You know, sports right now, especially in youth, has become less of just a seasonal situation. It's become a year-round event. And that unfortunately does lead to a lot of fatigue. It leads to a lot of overuse injuries and definitely a higher chance of injuries in general with these traumatic type ACL injuries. Orthopedics has always tried to seek out a less invasive way of performing a surgery, because less invasiveness usually means a faster return to recovery, less pain, less narcotic usage. I think a holistic approach is absolutely essential because it's not just the body part that's injured. We know one of the biggest risk factors for returning to play, or one of the barriers, is the psychological readiness. The challenge with returning to play is just how do you know for sure when the athlete's ready to get back? We use all these different objective criteria. In the end, you're taking that objective data and still making a subjective decision. So the hard part, and for us, oftentimes we're more conservative, especially with our young female soccer players, because the re-injury risk is so high.